Assalamu alaikum, everyone. Welcome to episode 5 of Nomadic Hustle. And our guest today is Dr. Qaali Hussein. She's a trauma surgeon in Florida and a mother of 6. She's also an entrepreneur, a speaker, and the host of the Professional Muslim Woman podcast. I'm your host, Mukhtar Sharif, and we have a packed episode for you today. We're going to be talking about professional development for Muslim women. We're going to be talking about how to advocate for yourself in the workplace. We're going to be talking about people who want to get into medicine. How do you do it? What routes are available to you? What different paths can you take? And we're also going to address some issues. I don't want to kind of give all of that away right now. We have some questions towards the end, and I'm really excited about this episode. Dr. Qaali came all the way from Florida to be with us here today. I think she's one of 7, 8 Somalis in Florida, and the other 7 are her family. So spouse and children included, about 8 people Somali Ahbadig in Florida. So welcome, Dr. Qaali.
Thank you so much, Mukhtar, for inviting me. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody.
Wa alaikum salam. So a lot of people know you from Twitter, Facebook, as a person who is a trauma surgeon, and at the same time is a mom to 6 kids. MashaAllah, ilaha barakah, all of them. And I think the question that comes to mind and how we're going to sort of get started is, how have you been able to do that, right? Having a full family, we'll get to that in a second, having a family of 6 people, 6 children, and still being able to kind of succeed at the highest level of your profession is one of the things that I think a lot of people are kind of interested in hearing about today. And that's something they can all benefit from and sort of use that as a motivation, and maybe some tactics you can give day to day, some action items that people can kind of be like, all right, if I want to achieve this, here's what I got to do. But first, I want to start with sort of your story and your background. Tell us where you're from, where you grew up, and how eventually you ended up getting into medicine.
Okay. So I grew up in Houston, but I was born in Somalia. We lived in Mogadishu, and we left when the war happened. So one of the significant things about my childhood that I do remember is that my grandmother, who raised me, was one of the victims of the war. While we were leaving, she was shot during the war. Trip to the airport, a bullet went through both of her legs.
Wow.
And we had to stop the bleeding. And I was one of the people who, was told to hold pressure.
SubhanAllah.
That was my first exposure to trauma. We couldn't leave. We had to go back through the same place, we were shot at. She went and got better, alhamdulillah. Then we came to Kenya about a few months later. That's where she recuperated and was able to walk again. We came to Houston. That's where we had family members already in the States before we came. And so that's why we ended up in Houston.
Okay.
Initially, there weren't that many Somalis in Houston, but now there are. And so my first experience with trauma and with someone being sick was that. I have an aunt who is a physician who was practicing family medicine in Somalia.
Okay.
And so we have a little bit of that in the family.
The background's there.
Yeah, and I've always been interested in medicine. And when I started expressing that, one of the people that was supportive of the fact that I wanted to be a doctor was my grandmother. And she was the one that kind of motivated me to, stop listening to all the naysayers, because I've always wanted to be. I like working with my hands. I like, when things are broken, I like to fix them. Electronics, I like to play with them. And so, having that plus an interest in medicine, I was, naturally drawn to surgery. And she was one of the biggest motivators of that, to say, don't worry about the naysayers and just
Your grandma.
go forward. My grandmother, yes.
MashaAllah. So that's the first sort of how you kind of got interested in medicine. And one of the people that pushed you was your grandma. Do you think you would have eventually went into medicine had you not had that support system, or have somebody sort of giving you that encouragement that you needed? Do you feel like that was a big part of
it? Was a huge part, because when I stated that, it was, when I was making the transition to really, accepting and wearing the hijab. And that was, one of the reasons people told me I couldn't be a surgeon was, well, you're going to have to, decide either the hijab goes or this aspiration goes. And one of the things my grandmother told me a story. And to this day, she's one of the biggest change agents that I know. She got married at the age of 13.
Wow.
Okay, to my grandfather, who was 40 years old. All right, she didn't go to school. She started having kids at a very young age. And so what she decided was that things were going to be different for her kids. Right, not having gone to school herself, not being educated, she knew a little bit of the Quran. And she used to always say, the Quran, like the first words that came down, Iqra.
Yeah.
So she knew the importance and value of education. And so when she had kids, she had 10 kids, right?
10 kids, mashallah.
She was my role model. I was aiming for 10. I settled for 6.
Mashallah to both of you guys.
But one of the things that she did was, being in a position where she is, she made the change for her kids. Boys and girls. She had 4 boys and 6 girls, and she made it mandatory for them, to go to school, to pursue their education, to pursue it full force, and equally between her boys and her girls. And so when the girls started reaching college age, she would have suitors come and ask for her daughter's hand in marriage. And she didn't fight against society's expectations and the norms. And she would be, very polite and say, oh, yes, let me talk to them, thank you. And she, in private, she would tell her daughters, I want you to go to school and I want you to be self-sufficient. And so naturally they listened to her.
Yeah.
And they got to the point where they worked really hard and got scholarships abroad.
Wow.
And in a time, it's like 70s, 80s, in a time where women were supposed to get married and have kids, she was letting her daughters who were unwed go. Like my mom went to Italy, my aunt went to Thailand, one of my other aunts went to London, one of my other aunts came to the States to go get their education.
This is coming from a grandma who got married at 13 and never had an opportunity to really go to school herself.
Right.
Wow.
Right. And while she was doing this, there was like the negative connotations from the community saying, oh, Father Ibrahim, they're doing this, they're doing that, like all the bad things.
Yeah.
But they were, they went out, they got their education, they came back, they got married, they had kids, and
Mashallah.
they have successful careers.
Yeah.
And she was the single person who decided, you know what, I don't have to fight. I don't have to argue with anybody. Like, it was a decision that she made, and she made it happen for her kids. And so she told me that story when I was, distraught and, really struggling with pursuing something that I was clearly being told, this is not for you. And she said, you don't have to ask anybody permission.
Just
right?
do it.
Just do what it is that you need to do. And all the naysayers, watch and wait and see what they're going to say after you're done.
Well, that's power. How old were you when she was telling you this?
I think I was like 15, 16.
That's a powerful kind of conversation to have with a teenager.
Yes, and that is one of the conversations that continues to play in my head to this day. Anytime I get, there's something challenging, I listen, to her words, and realize that, what, there are ways around things, right? You don't always have to, ask for permission.
Yeah.
And if the standard way is not correct, then you go find another way, right?
Wow. Shout out to your grandma. I feel like we all need people like that in our lives to put us on the right path at a young age, right? I told you my older brother is a doctor. He lives in Atlanta. And for him, I remember he started going to undergrad in 2007. And in 2006, he came to the masjid and he's just telling these kids, hey, I'm going to be a doctor. And these young Somali boys could not believe that a Somali person could become a doctor. Like that to them, it was a profession reserved for Adan and other ethnicities. They were okay with a Pakistani doctor. They were okay with Adan doctors and Arab doctors. But they're asking my brother, and obviously they're innocent, right? This is not coming from any malicious sort of intent on their part. They're just like, how are you going to become a doctor, right? So I feel like that's something that a lot of our youth need to hear. This is one reason why you're on our our show today is to kind of exemplify some of the things that we want to show the younger viewers and the younger people that are having these doubts. Like, can I do it? What would you say to, let's just say, like a young 18, 19-year-old, 17-year-old young Somali girl who wants to go into medicine, is having these doubts? What kind of advice would you offer?
So one of the things that I normally tell young women who reach out to me like this is, I think it's very important to go into these difficult fields with your eyes wide open, right? I think sugarcoating things and saying it's going to be easy, you can do it, everything. Yes, you can, but I think it's so much better when you come prepared, right? There will be struggle. You will have to sacrifice certain things, but if you are truly passionate about it, you can overcome anything, right?
And have a work ethic.
And good work ethic. Know that you're going to be sacrificing a lot of things. You're not going to be able to do things that other people your age, want to do. But if you're truly nerdy and want to go to medical school, I enjoyed studying. Right? If you really want to do it, if you're really passionate about it, then don't listen to anybody who's going to tell you, that it's going to be impossible. Especially people who haven't seen it, who haven't done it. Right? That's one of the biggest problems I had. And once my grandmother, had that talk with me, I would always look at, where is that information coming from? Right? The people that are telling you, no, it's impossible. How do they know it's impossible? Besides what society tells us and besides what the norm is, what other information do they have? Like if
what
someone
qualifies this person to advise you on this topic?
Exactly. So if someone it's on the inside tells you, hey, it's going to be really hard, but you know what? That's how it is. Then I will take that person's advice and say, you know what? Okay, I got to toughen up. This is going to be tough. But someone who has no idea what it feels like to be in medicine tells you, oh, you're not going to make it. Then don't listen to them.
Yeah, that's great advice. I think a lot of time the people that advise us against endeavors, it could be anything. It could be college, it could be medicine, it could be going into the tech industry. A lot of times the person is judging your capabilities based on what they can and cannot accomplish. So a lot of times you'd be asking someone and they tell you can't do it, not because you, as Dr. Qaali, is not capable of this, but because they have limited themselves, right? So I think the point you're making here is that we have to be conscious about who we're asking for advice. You can't just ask anyone about, hey, what do you think if I become a surgeon? And this person is like, all right, no, there's no way. They're just automatically judging you from the beginning. They don't know your work ethic. They don't know what you're capable of doing. They don't know your grades or your intellect and what you're capable of. So I think that's a good point that you brought up. Yeah,
I mean, I've been laughed at. I've been laughed at.
What did they laugh at? What did you say?
The fact that I wanted to be a surgeon. Like, I have literally been laughed at, while I was in college, while I was in medical school, the fact that I wanted to be a surgeon. I was in a medical school interview where the person interviewing me basically talked about nothing but my hijab.
Wow.
Right? My qualifications, my interests in medicine, none of those things mattered because automatically I was disqualified and the only thing she had anything to say about was my hijab.
That's crazy.
Yeah. These kinds of things happen.
How do you handle that?
So it depends on where you are in the hierarchy, right? Medicine is a very hierarchical field. And when you're at the bottom of the totem pole, there's very little you can do, right? For me, what I ended up doing was in places like this, there are reporting mechanisms in place, but they out you. There's nothing anonymous about it. Right? So there's a lot of things, your rights are violated, right? Freedom of religion, all those things, they're violated left and right. Women's rights, people ask you, oh, you're pregnant, you're going to have, are you planning on having kids during, this training?
Isn't that illegal?
It is illegal. It is absolutely illegal. And these programs, especially residencies, are funded by CMS. So it's federally funded, and they're violating your rights. Right. So these are the things that we're speaking about. We're speaking out about right now. But it's such a hierarchical system, and everybody knows everybody else that if you raise your voice, you automatically become the trouble student. So one of the things that I used to do was just go interview as many people as in many places as you can. And if a certain place is going to treat you like that in an interview, they're going to treat you like that during training. So I would rank those people.
You probably don't want to be there.
You do not want to be there. So I would rank those people and either very low or not even put them on my list.
Yeah.
And as you advance, there are, certain things that you can do to start speaking up for yourself and not accepting certain things. Like I remember, I think we can get to that a little bit later. Like when I was told I couldn't get into the OR because of my hijab.
Wow.
Right? So I've gotten there. I did all the work and I was supposed to be there. I wasn't going to go back, right? I wasn't going to quit.
You had no choice but to keep going.
So at that point, that was a fight that I had to have because, I wasn't going to leave.
Yeah.
So it all depends on where you are and what's at stake.
OR is operating room?
Operating room, sorry.
Right. Only those of us who watch like Grey's Anatomy would understand what OR means. Like for the rest of us.
Operating room.
Yes, we gotta perfect. And a lot of people that heard the intro heard me say that you live in Florida.
Yes.
Why?
So one of the things that I learned during my first interview for a job was one of the worst interviews of my career. I've had plenty of bad ones. This one was a chairman who basically threw my CV across the table and said, "You've accomplished nothing over the past 5-6 years."
Wow.
That's after finishing residency, having 5 kids, being pregnant with my 6th one, in the middle of a fellowship, board certified, basically said, "You've accomplished nothing." And then threatened me during the interview because I talked about my kids, right? Because it's who I am. It's an integral part of who I am.
You can't separate that from you.
So, but that's a lot of the one of the problems that we have in medicine is that, motherhood is penalized, right? So if you're a mother, you're assumed not to be productive, right? You're not going to generate as much money as your male colleagues. So they take that into account. And so you're offered less money. Certain jobs won't even take you, right? So after that crushing experience, I decided, I had to basically reevaluate exactly what success meant. If I set out to do something, and I only wanted to have 2 kids by that time, and then have more after I was done. Yeah. I had all 6.
MashaAllah.
Right? So by my own standards, I've already, surpassed my goals, alhamdulillah. So I'm at a point, I'm like, I was told, this was impossible. And now I've gotten to a point where the impossible, I'm told, is nothing. Mm-hmm. Right?
Wow.
So I can't look for a job the same way as everybody else, right? If my success is going to be defined as nothing, then I have to change how I job hunt. Mm-hmm. So it was basically like a mindset change for me. And so what I decided to do was, number one, I would own my own success, right? I would be the one saying this.
You wouldn't let it be defined by somebody else.
Exactly. Like, this is who I am. I'm a board certified, fellowship trained surgeon.
Yeah.
Right?
In their face.
In their face.
Yeah.
Yeah. Not only am I a general surgeon, I'm an intensivist. I did my fellowship in surgical intensive care, critical care. Right. I'm board certified at times 2. I sat down for 2 boards.
Wow.
Right. So I'm not going to let anybody define what success means. Mm-hmm. And then number 2, my faith, my hijab, the fact that I value my family is an integral part of me. Mm-hmm. That gets brought to the table. It's not something I'm going to hide.
Yeah.
I'm saying this is important to me.
Up front.
Yeah. Yeah. And I think when I was going for more interviews at that time, I was fully pregnant. I was showing by that time. I was 8 months. And I basically sat there and was like, this is who I am. And so either take it or leave it. And if you're in a, if I'm in an interview and someone sees me as a failure or sees, everything else that comes with me as baggage and not as an important part of who I am, then they don't deserve me.
Wow,
they don't deserve me to be part of their team.
So that's what your mindset became.
That's what my mindset became. So I started interviewing, and I got a fabulous offer in Florida. I got a little too confident. I started negotiating for things that weren't even on the table, and Florida delivered.
Where in Florida is it?
Bradenton.
What's the closest
Tampa.
city they are?
Tampa.
Near Tampa? Okay, perfect. And I think I want to go back to that for a second. You talked about mindset, right? So when this, I'm guessing it was an Adan guy.
Yeah.
Adan guy.
Surprised.
Surprise. You go to this Adan guy and he says everything you've done over the past 10, 15 years in your life that you and any normal person would see as you doing the impossible. You come to this interview and he says, oh, this is nothing. You've done nothing, right? You have two options going into mindset. Like, you have two options. You can let this crush you, right? That's one option.
It did initially. It crushed me. I cried.
Yeah.
I ate a lot of Mexican food.
That's his therapy.
Therapy, yeah. And actually, speaking of that, I've gone through a lot of things like that throughout my residency, and I think it made me a much stronger person at the end. And I would go through this cycle of, I would, do my best, and then I would be told it's nothing, right?
Yeah.
The same thing, that was the biggest, that was the worst case of it.
There's a lot of events that sort of led up to that.
A lot of things led up to that, and I've never experienced it that much. That's why it still crushed me. But I've gone through a lot of that, and I would go through the cycle of getting upset, getting sad, crying, getting angry, getting just defiant, and saying, I'm going to show you. And so it was this repetitive cycle. Yeah. And every time I would get stronger and stronger and stronger. And finally, I got to a point where I think it was at that time that I decided, you know what, I'm placing too much power in other people's hands.
Okay.
Right? When I let myself get affected by what they say, we're giving people too much power. Right? So right now, I still experience, certain things like that. People who don't know, people who've known me for years know who I am. And, that when I'm on, my trauma call shift, that I run a tight ship and I'm very demanding, but then they got used to it. For years, people had a problem with it. I got reported almost every day for a year. Because
how much of that is because you're Dr. Qaali, because Muslim baat hai,
because it's a lot of implicit bias.
Somali baat hai.
Yeah.
If you were an Adan girl, how often would you have been reported with the same personality?
As a woman, you would still get reported.
Okay.
Right? If you were Adan guy, you wouldn't get reported. You would be, oh, he's confident.
Okay.
Right? As a woman,
so there's several layers.
There's several layers,
okay.
And that's where, for me, it's a lot of intersectionality, right? I'm a woman, I'm black, I'm Muslim, I wear hijab, right? I'm
Somali.
you're like Mr. Somali. So it's a lot of that. Yeah, it's that intersectionality, and it was happening for almost every time I was on call, right? And I got to a point where I said, you know what, this is not going to happen anymore. So next time I was like, the only things that I demand are that things be done right, right?
So you're demanding stuff that makes the job better.
Yeah,
you can do a better job.
I'm demanding standard of care and optimal care for my patient. And people don't agree, and they'll either they'll doctor shop and say, Dr. Hussein ordered this, but I don't think it's right. Right? Somebody who's not a doctor is going to second guess my order,
decision,
right? So finally, I sat down and I was like, let's nip this in the bud. Like, next time someone complains about me, I want them sitting right here, telling me why. If is it my decision making? Is it what I ordered? Is it, am I hurting a patient? No. They have a problem with my confidence, my tone. It's my job.
Yeah.
Right? Tell them to grow thick skin.
Yeah.
So.
Wow. I'm intimidated. Bismillah
But see, I think this is the kind of things that as minorities in a lot of these fields, we have to advocate for ourselves. Right? I mean, if I was to just accept that, I would have, and if I didn't stand up for myself, by that second year, I would have left. Right? I've been there for about almost coming to 5 years now.
I also think that had you went in there as some miskeen trauma surgeon, as someone who, let's say you order something and then she overrides your order and you're like, okay, I'll just go with what you said, they're just going to trample on you.
Of course.
Right? Yeah. And I think that's in any profession. I mean, I work in tech. My building has 600 people in it that I work. My company has 600 people at their headquarters, and there are 4 or 5 of us people of color, and there's 2 Somalis.
Wow.
The rest, I mean, in my professional career, I've never been in a meeting with a non-white person.
Wow.
Right? And I have meetings every single day, 365 days a year.
That speaks.
You know what I mean?
Yep.
So when you get in those type of situations, it's important to understand that, you know, these people view you differently. Mm-hmm. You have to be clear, you know, when you speak. You also have to set clear boundaries, and you have to check them.
Yep.
Right?
Oh, yeah. Some of the people that I work with right now, when I'm on call, they're like, "Oh, Hussein's here. Y'all know what to do."
Yeah, they have to know what's up, because I feel like you cannot go in there and just be normal, and they would take that as something else.
Yep.
Right? Like as an invitation to just walk all over you.
Yep.
And I want to, so the thing we're talking about was mindset earlier. For a woman, a young professional, or anyone, Somali woman, that's going through that situation, that crushing experience that you had, where basically they're telling you you've accomplished nothing, mm-hmm. and you don't deserve the job or the position, or you're not qualified, when you clearly are. Mm-hmm. How should they respond? So
in the setting, it depends, right? So in a professional setting, letting your emotions take over you, I think, is shaky ground, right? Depending on who the person is, you have no idea how they're going to react. You have no idea if they're going to say, okay, you know what, this is understandable, I'm sorry. Or they're going to say, oh, this is how you're going to react, and then they're going to get worse.
Okay.
Right? So you have no idea. So one of the things that I used to do, and I think being trained in a very hierarchical field kind of taught me to kind of check my emotions, I wouldn't swallow it. I would go home and I would have a sounding board, whether it was my sisters, my mom, my husband, you know, friends, like let it all out, mm-hmm. right? Whether it's through tears, anger, cuss words, whatever it is, talk it out.
Get it out.
Yeah. If you're a writer, write. If you're a speaker, like go talk, you know, however you get that stuff out, get it out. And when you do, when you talk it out, you find the root cause, mm-hmm. right? I think one of the biggest problems that we have, and why I think there's a lot of burnout in medicine especially, is we have this persistent, you know, abuse, and you just keep it in, and you never resolve anything. But one of the things I was lucky to have is I had this sounding board, and I would talk it out, and I would, at the end of it, I would have a clear plan. I would say, okay, if it was something silly that I did and I got, you know, rightfully reprimanded for, you know, doing something wrong, then I say, you know what, my bad.
It's my fault.
Yeah, I learned from that. Next time, I'm not going to do. I'm going to do this differently.
Yeah.
Right. It's a learning it's a learning point. I move on.
Yeah.
Right. Emotions are all out. I go back to work the next day. It's a brand new day. But if it's something where it's the system and there's something wrong and it keeps happening, you know, the same time over and over and over, like my pregnancy.
Yeah.
Year after year after year, it would be like, oh, you're pregnant again. Yeah, you're not going to come back. You're not going to do this. You're not going to do this. For many years, I kind of held it in. I took out the anger, you know, on my family at home and expressed everything.
Masakintas.
Yeah, they heard it all.
Hey.
And then finally, when I was like at the end, I think I was a fellow and I was pregnant with my sixth child. I had an attending come to me and say, Ali, he saw that I was pregnant again. He's like, you know, I'd hate to be your co-resident, out of nowhere. And mind you, this is a guy who nominated me and gave me an award the year before.
Wow.
Okay? And so I've had it, and I'm a fellow right now.
How disrespectful is that for us, not in the medical field?
It's very disrespectful.
Like, what does it mean when someone says they don't want to be your co-resident?
It basically means that you're not a team player, that you're selfish. I've been called selfish multiple times.
Wow.
Yeah. So I'm at the end, and I've proven myself. I've passed my boards. I'm, you know, last few months waiting around to finish, right?
Yeah.
And at that point, I decided I need to speak up for myself. So to an attending, I said, "Who cares?" Mm-hmm. And then he turned beet red and realized what he said. And I said, you know, you guys have been saying stuff like this for years. Do you know how inappropriate it is? And before I could even get into, you know, all the details.
You're about to unleash on him.
He was like, I don't want to get sued. He was using my phone charger in my office. He took his phone off and almost like fell over backwards trying to get out of the room.
Wow.
Like, they know it's something wrong that they do.
Yeah.
Right? But nobody acknowledges it because we all take it. Mm-hmm. But if you get to a point where you can speak up and say something,
you should speak up.
You should speak up, and that's why I speak up now, and that's why I write about it.
Yeah, that's why you're doing all of this stuff that we're going to get into towards the end of our episode. Thank you for sharing that. And you mentioned you have 6 children, mm-hmm. mashallah. I think you said 5 boys and 1 girl.
Mm-hmm.
ilaahay ha ku caawiyo oo ku ducee dadka waxaan dhegeysanaa aamiin dhaha.
Amin. Thank you.
5 boys ma sahlana, mashallah, and your daughter is the firstborn, so
Yeah,
she's the oldest.
she's the oldest,
She's gonna come out a fighter if she already isn't.
She already is.
She's already a fighter.
She's feistier than I am, so.
Mashallah, ilaah ku garab galo. I'm making like the old Somali du'as for you right now. This is like the odayaasha ducooyinka
Amin.
ee bixiyaan baa hadda kugu duceynaya. So I think my only question is, how did you do it? Obviously, this is not like a short. There's no short answer, but
Yeah.
you know, it's already difficult enough being. So 2 parts to this question. Part 1 is it's already difficult enough being a mom and a professional mom. Let's just say even with just 1 child, that has it comes with its own challenges, and it comes with its own obstacles. And doing that 6 times over, now you have 6 children at home, and still being able to go through college, residency, fellowship, and now in your career. How did you do it, and what advice can you offer for moms? And the second part to the question is, what advice can you offer to moms with children who still haven't gotten to a profession, who still feel like, you know, I feel like a lot of moms are like, I have all these children, especially Somali moms, have children, 3, 4, 5, 6 kids, 7, whatever it is, and they think that the rest of their life could just be raising children, which is great if that's what they want.
Yep.
But I feel like for those that just think it's over, right? It's done. The ship has sailed. I can't get into a profession. I can't go back to school. I'm in my 30s. I'm in my 40s. How am I going to do this? That's the second question. What advice would you offer to them?
So for the first one, I would say, you know, I think I was able to do this because I'm Somali.
Okay. What does that mean?
That means, you know, I mean, we live in a Western world, right? People have 2 or 3 kids, and they have like live-in nannies and things like that.
Yeah.
As Somalis, we don't need that, right? We have parents, siblings, in-laws. We have a support system. Our tradition of our families being close-knit was a huge part of my success.
Okay.
Right?
Mashallah.
I don't think if I wasn't Somali, I don't know if I could have done this.
Yeah, it's tough.
Right?
Yeah.
I don't know if I would have had 6 kids if I wasn't Somali.
Probably a couple cats.
Maybe
2 dogs. Like all my coworkers, hey?
Right. But I think, you know, having that close-knit family really made it possible for me. And so, you know, for people to say as a Somali, you know, motherhood is a priority, and, you know, education, you know, isn't a priority, and when kids come along, you know, it's off the table. I think we're not taking into account our biggest strengths, right? When you need help, our families kind of, you know, initially some of my family told me, you know, no, I don't think this is going to be possible for you. Especially like they knew I loved kids and I wanted to have a lot. They knew because of that doing this would be impossible. But when I was doing it, guess what? They were all on board. Right?
Okay.
When I was on call, you know, my kids, some of them were at my mom's house, my aunt's house, right?
Just
like it was free for all.
Yeah, mashallah, mashallah,
right?
mashallah.
So, and one of the things that I really, I like to stress, especially when I'm talking to Somali youth, is, you know, people in your family, if they're the ones to dissuade you, don't cut those ties. You know, they may be giving you advice based on their limited view of the world and what society has told us is normal and acceptable, right? They may be warning you from a potential, you know, long time of hardship.
It might come from a good place. They actually really care about you.
Yeah, and they don't want you to struggle.
Yep.
Right? So, and a lot of people, especially young people as teenagers, the way they take it is, oh, you know, you don't want me to be successful. Yeah. You hate me, and, you know, things like that. And they tend to, you know, get separated from families and say, oh, that person does not want me to succeed. Trust me, if you are stubborn enough, I mean, we're all Somalis, we're all stubborn, right? If you're stubborn enough to go after a goal, when you are in the thick of it and you need help, your family is going to be there. right?
Wow.
Whether they were naysayers or not, they will be there. They will be there to support you. That's how my family was.
So that support system was integral and
very important. Without
this
it,
journey.
Yeah, without it, I don't think I'd be here today.
Perfect, mashallah. And what's the second part then to the women that are in their third, fourth, fifth child? And
so I've actually, when I started, posting about these things and started writing about it and speaking about it, those are the women that I heard from, right? And that's one of the reasons we started the Professional Muslim Women podcast is, how do you navigate motherhood and career? And for people who, prioritized motherhood, but now still have a longing to have a career, how do you go about it? I think we, as a society, and especially our community of Somalis, we think kids are all time consuming. I know fathers do. But, one of the things that I learned, I think through my training, is giving people, responsibility as they grow. Right. And so if you instill in your kids responsibility, them getting themselves dressed and ready and chores and things like that, you don't have to do everything yourself.
Yeah.
Right. If you delegate, especially if your kids are a little bit on the older side, if you delegate, you can take a lot of things off your plate. Right. You can delegate a lot of things such as, house cleaning and things like that. Someone called me or messaged me not too long ago about how to study with kids, right? If you have a Somali family and they're supportive, drop off the kids, go study, right?
Yeah.
Protected time, right? I used to, one of the things that I used to do, and this is actually very interesting. The more kids I had, the more I studied, the more I read, the more I learned, the better my training exam scores. I kid you not.
How?
I kid you not. Because what happens is when you have responsibility, right? Mm-hmm. The more responsibilities you have, all the unimportant stuff falls off, right? The things that are time wasters. For me, it was social media.
Yeah.
Right?
So you budget basically your time to the minute.
Exactly. So I got off of social media when I was an intern, and what I had on my phone was PDFs of my textbooks.
Wow. So you're just studying all the time.
I would, in between cases, waiting for a patient to come to the operating room.
The OR.
The OR. I would sit there and read, a few things here and there. I would, one of my books was in my car, and the binding melted off. I took it apart, and piece by piece, I would put it in my coat pocket. When I would have downtime, I would read a chapter a week.
Wow.
Right? So, time management, I think, is one of the most important things to learn for working mothers or mothers who are planning on going back to school. Mm-hmm. And setting boundaries, learning to say no. Those are all very important things if you want to accomplish your goal.
So time management, number one thing for if you want to a mom that wants to get into a profession or go back to school or set whatever goals that she has for herself that she has to put that. Yeah.
Time management and boundaries.
Perfect. And we're getting towards the last part of our show, our episode here. So I want to get into a few questions that go along with some of the work that you do. Okay. So first I want to get into the work that you do in personal development, right? Mm-hmm. How can people sort of improve their lives? And you do a lot of work with professional Muslim women. Mm-hmm. Can you touch on that just for a few minutes on what are the top things that you should keep in mind as a professional Muslim woman in your development?
So as far as being a professional Muslim woman, I think one of the things that is lacking in a lot of fields, and the reason we created the Professional Muslim Women podcast, is we come across a lot of challenges and a lot of barriers, and other platforms that teach personal development really don't focus on it, right? We are supposed to be mothers, we're supposed to be professionals, we're supposed to be spouses and do all these things. Time management is one of the most frequently asked questions I get, mm-hmm. right? How do you manage your time? Right? Yeah. How do you prioritize things? All these things that you have to do. Block scheduling is one of the things that I talk about.
Yeah.
Right. So, if you're doing multiple things at the same time, if you're multitasking is actually a bad thing. Some people think it's a great thing, but when you're multitask, you're actually less efficient.
Yeah. So you're doing a bunch of different things, but you're not doing them all well.
All well.
Yeah.
Right. So one of the things that I do, and I've changed my schedule over the past couple of years, is I block schedule. Right. I take all of my calls together at the same time. So when I'm on work mode, I'm 100% work mode. Like before I go to, before I start my week of calls, I'll, get the house together, cook a lot of food, get, do groceries and,
get
laundry.
all of the house stuff arranged and taken
for
care
them.
of. Yeah.
And that would hold them for, 3-4 days. And like after that, I'm like, you guys are on your own.
Yeah.
Right?
Do your thing.
And then my husband will do like takeout or whatever. And the kids learn how to do their laundry and things like that. But when I'm on work mode, I'm 100% work mode.
No distractions.
No distractions. I try not to do anything else. When I'm not working, I try and, the other 20 days that I have, like 1 week I'll work on, getting the podcast. The other week I'll work on, the other course that I teach for nurse practitioners and PAs. I'll block schedule so that when I'm focused on something, I
give it your all.
I can give it my all, right? One of the biggest problems professional Muslim women have is that you're required to do a lot of things, and you want to do all of them well. So time management, block scheduling, self-advocacy, right? A lot of the things that we come across are like the being asked those inappropriate questions. I've been called a terrorist at work.
What?
Yep, day 3 of being a doctor.
Wait, by a patient?
By a patient.
Okay, I was going to say there's no way a colleague could get away with
a colleague.
calling.
No, I mean
they won't call you that, but they'll find ways to sort of still get at you.
An interviewer, basically said I don't belong in medicine because of my hijab.
Wow.
Which
is just as insulting.
Yeah. So there are a lot of things that
So the
happen.
patient called you a terrorist.
Yes.
What? I work in tech. It's not no customer facing stuff. None of that. Me and my laptop, my computer, some screens, and some Hadan people drinking coffee next to me. That's kind of my environment. I don't deal with patients. Yeah. How the hell do you deal with this? Was this in Florida?
This was in Texas.
Same. Come on. Same thing. Why?
Southern.
Southern Trump country, all red.
Yeah.
Adan guy.
Yeah.
La ilaha illallah Muhammadur Rasulullah. 3 for 3 Adanka today.
Yeah.
Everything that you've mentioned. So far.
There are
taking a lot of L's.
Oh,
so the guy walks in.
No, so it was a patient that had he had an infected toe that needed to be amputated, right? So I'm an intern. It's like my 3rd day of being a doctor, right? I don't know what I'm doing. It's like 5 o'clock in the morning. We're changing wounds. My job is to change the dressing, and so we come in. He doesn't want to get his toe cut off, and
he wants to keep his toe.
He wants to keep his toe.
Okay.
It's dead. It's black. It's infected. It's gross.
He wants to hold on to it, though.
He wants to hold on to it.
Hey, go ahead.
And so
I don't have these conversations. Obviously, you can tell I don't have very many conversations about dead toes. So I need to get it all out right now. Hey, go ahead.
So my senior resident is standing there, and for the past 3 days that I've known him, she's been trying to convince him that he needs surgery, and he keeps saying no. And then every day he complains about something new. This 3rd day, he ran out of stuff to complain about. And so I'm sitting here, I have I'm holding this thing that has like dressing changes, and I'm doing this.
So you're changing his toe dressing.
I'm changing his toe. Yes. And he says, and she comes in here. I'm at the lower end of the totem pole. I don't talk to any patients. I just come here, do what I need to do.
You just change the toe stuff and you do your thing and go.
That's it. And he's like, and she comes in, 3 days ago, doesn't introduce herself. I watch the news. I read the newspaper. She could be a terrorist for all I know. This is like in 2008.
Man, 2008. That's when Obama got elected.
Yeah. So and it's like 5 o'clock in the morning. I haven't even had coffee, and I'm like really?
If I were you, I would have just took his toe off right there. Call me a terrorist one more time.
No, actually, this is the conversation that goes on in your head when you're caffeine deprived and being called terrorist in the morning. I'm like, wait. I was like, if I was a terrorist, would I wake up at 5 o'clock in the morning to change this dressing? Am I like terrorist?
I would not be touching your toe.
I'm like, am I a terrorist against bacteria, like death to MRSA?
Terrorizing.
So and then like I finally joined the conversation, come down to earth. And I hear my resident saying, "Sir, I assure you, she's not a terrorist."
The fact that he has to even say that. First of all,
it's a she.
She has to even say that. Yeah. I mean, I do kind of understand it's Texas.
It's Texas, yeah.
So I think the question everyone is wondering, all the people that are listening right now, did you take his toe at the end?
Yes.
So you got the last laugh. Yes. Joke's on you. The toe is ours. Moving on from the toe story. I don't even know where we were before that. We're talking about personal development.
Standing up for yourself.
Yeah.
Yeah. So, those are the kind of things that a lot of other people don't talk about, right? Because nobody has to do that, right? So I talk about that and I teach that. How, at what point do you need to start advocating for yourself, and how can you be part of the change? Obviously, if you're in a system that's consistently pushing you out and saying you don't belong here, right? You're not obligated to sit there and take that every single time, right? You can be part of the change to say this needs to change. This, we need to have policies. These things are inappropriate. These things are appropriate.
Our next question, we got probably like 5-10 minutes remaining here, and one of the things that a lot of people, I think, ask you a lot that you mentioned earlier was, how do you deal with adversity, right? How do you deal with situations where, you're fearful of something? There's so many obstacles ahead of you. There's just so many things going on. How do you push through in those scenarios?
So one step at a time, right? If you sit there and you think about all the potential pitfalls and all the possible challenges you can face, you're never going to move.
So don't be crippled by the thing that's in front of you.
Yeah. Yeah. Just if you want to do it and if you're serious about it, the best thing that you can do, and one of the reasons I talk about, the pitfalls of the journey more than the triumphs and the successes, is when you know what's coming, when you know the potential, problems, you can think ahead and say, okay, if this happens, this is what I'll probably do. This is how I'll react. Right? When you're prepared, you can handle so much more. But if you sit there and all you think about is, oh my God, it's going to be bad, then you're not going to take any steps. So what I usually say is, everything is risky. Everything in life is risky.
Yeah, there's nothing guaranteed.
There's
100%.
Nothing guaranteed. Getting married is risky. Being an entrepreneur is risky.
Yeah.
Pursuing a certain degree, like everything is risky, right? But how do we do all those things? You take one step at a time. So, deal with this step that you're on right now. Once you're done with that, go on to the next step. Whatever challenges come along, as long as you have the right mindset of how to deal with challenges and failures.
Also setting expectations.
You set your expectations, but the other important thing as far as setting expectations is, how do you deal with failure? How do you deal with not meeting those expectations? Right?
Okay.
So a lot of people are crippled by failure. There's a fear of failure. Right, the way we look at at failure in surgery, like complications, death, those are bad things, right?
Oh, yeah.
Ours, it's like the ultimate form of failure.
Yeah, that's like the
right. That's the
can't
ultimate,
come back from it.
Right, but just because one person died, do you stop operating?
Yeah.
Right? No,
you
don't. You say, okay, what exactly happened? How did it happen? What are all the different contributing factors, and what can we do to make things better so that our next patient doesn't have the same outcome?
Yeah.
Right? So fear of failure, I think, is misguided. Right? Failure can teach you a lot of things if you look at it that way. If you look at something and say, I'm afraid I'm going to fail, and fear, and you have so much fear of failure that you're not going to move, then you're looking at failure wrong.
So you should look at it as like a learning opportunity.
Failure is a learning opportunity.
And just move on.
Yeah.
Okay.
So learn from it. Like, don't move on. Say, what did I learn?
Yeah.
Right? There's a really good book, Principles, by Ray Dalio. And he's an investment guru. I think he's a hedge fund manager or something like that. And he talks about like all the different principles he learned in creating this big multi-billion-dollar company. And one of the things, you'll see it at the presentation, is pain plus reflection equals progress. Right.
Wow.
Whatever pain, whether it's failure at work, at home, personal life, whatever it is, if you don't reflect on that, you're missing an opportunity. When you reflect on your pain, then that is an opportunity for you to progress and get better.
So you could basically turn anything into a learning opportunity. So you have the option in your mind, in your mindset. of how you're going to react. That's what you have control of, right?
Yes.
How you react to things that happen to you.
Exactly.
Perfect. Our last thing that we sort of want to talk about is, what are some long-term plans for yourself? Obviously, you're a trauma surgeon. That's your, I guess, 9 to 5, not a traditional 9 to 5. And I'm sure it's not 9 to 5. You probably have like 12-hour shifts
24-hour shifts.
24-hour shifts where you're doing things like removing toes. I
leave toes to other people.
No
now.
Toes.
I do chests and
so
abdomen.
You moved up, moving on up the body.
Yes.
Toes I started from the bottom.
Yes, exactly.
So aside from the traditional, the work that you're doing, what are some goals that you've set for yourself, long-term goals, the stuff that you're involved in? You mentioned some stuff about like entrepreneurship. Mm-hmm. You said you teach some courses. You also have this podcast. Can you go into that a little bit before we finish up here?
Yeah. So, once you get to a certain point and you accomplish whatever it is you set out to accomplish, you kind of have to look at long-term goals, right? 5, 10, 20 years down the road, where do you see yourself? And that's kind of like having a map of life, right? If you're not looking ahead, then you have no idea where you're going. So when you have a goal, then you can make decisions to work towards that goal. I have 6 kids, alhamdulillah,
mashallah.
but I have to plan for college and things like that. And actually, one of the most interesting things is what the inspiration for my entrepreneurship came from someone who, for years, from my intern year till the time I graduated, told me that it was impossible, that I couldn't finish residency. And I finished residency, and then I was doing a fellowship. And then when I was finishing my fellowship and I was board certified, which shocked him.
Wow.
He was like, oh, you're gonna, this is a terrible test. We've had multiple failures. The past couple of years, you're not gonna do well. I told him, I was like, I passed on my first try, and his jaw dropped on the floor. And he was like, oh, it's easy, right? It's easy, right? Of course.
Now he says it's easy.
Yeah. So when I was finishing, one of the last things he said to me was, Qaali, yeah, now you're finished and all, but you're never gonna be able to send your kids to private school.
What?
Mm-hmm.
So now it's like, first he doubts everything that you've already accomplished, mm-hmm. and then you did them. Mm-hmm. And now that you did all of that, he finds the next thing. The next thing.
Yeah, but this is where what we just talked about, pain and reflection, equals to progress, is very important. Because before I used to be like, okay, you're rude, and then walk away, right? Mm-hmm. But because I'm constantly, doing like that form of thinking of learn from this failure so that we can improve care for our patients, I started applying it to my life and to every interaction. Yeah. And so when he said that, I thought about it. I was like, why would he say that? And then I looked at the numbers and I looked at the finances, and yes, even though like the pay significantly increased, from being a trainee to board certified surgeon, right? But you also have to take all the debt into account. You have to take all the living expenses into account. You have to take all the kids into account. And it hit me, and it's like, you know what? It may not be completely accurate, but there's some truth to that.
It makes some sense.
It makes some sense, right? Yeah. I mean, he didn't mean it to be enlightening.
Yeah, he meant it to like try to crush you again, to like put you down.
Yeah, but I started thinking about it, and I'm like, and then I started reading more and more about financial planning and things like that. I saw specialists, and my husband is an accountant, so we like really sat down and like did the whole numbers thing and said, we can do all these things and, pay down debt and this and that. But if we want to accelerate towards financial independence and be able to fully, support our kids and live a more comfortable life and not be, indebted, tied down, then we kind of have to start, thinking outside the box.
This is where the entrepreneurship came in.
And that's where the entrepreneurship came in. So, I mean, right now I am working on a course that we created over the past year. It's called Advanced Surgical Skills for Advanced Providers.
When you say course, what kind, like where are you distributing this?
So this is, right now, it's an in-person course where me and another surgeon and our physician assistants and nurse practitioners, we teach trauma, acute care surgery, critical care. We teach how to do procedures, how to put tubes in people's chest, do central lines, put someone, a tube in someone's airway so they can breathe. Mm-hmm. So we teach that. Our next course is actually coming up in January. And we created this course because there's a huge need. We rely on these physician assistants and nurse practitioners, but there is no such training for them anywhere. And so
wow.
I've seen it in multiple other hospitals.
So you saw the opportunity.
I saw the opportunity,
yeah.
And so I created the course, and now that's.
So anyone who's interested, where would they find?
So
this?
we have a Facebook page, Advanced Surgical Skills for Advanced Providers. Traumapractitionertraining.com is our website, and we do limited courses, 30 people per class, so that we can do the
Who would take these classes?
Nurse practitioners, physician assistants, students, EMT, like paramedics.
Yeah.
So anybody interested in learning these procedures who take care of patients or family nurse practitioners, they can do it too. To learn, if they're dealing with emergencies, then this is very important.
Perfect. And you mentioned, so you got the course, and you do a lot of speaking engagements. So what kind of stuff do you usually cover in that?
So when I talk about, a lot of the conferences that I go to are women in medicine. We talk about, advocating for yourself, time management, being a change agent. I'm going to another one, I think March. I think American Medical Women's Association is another one. We also have the podcast.
Yeah. We're going to share the link on this post.
So it's the Professional Muslim Women Podcast. One of my biggest passions is, because Muslim women are a small minority in almost every field, we don't have enough numbers to have a big impact in one specific field. But we chose, Professional Muslim Women, that name because, there's a unique challenge that Muslim women face.
Yeah.
Right? Whether they wear the hijab or not,
the challenge is still there.
The challenge is still there. I actually had a couple of people. One was asked why she wore the hijab. The other one was asked why she didn't wear the hijab.
Can't win.
Yeah. Right? Motherhood. If they have kids, it's a problem. If they don't have kids,
still a problem.
Still a problem. Right?
So tackling those type of issues and speaking about them.
And also learning, if you're in that situation, how can you do it in a way where you're not compromising your opportunities, and you don't want to burn bridges, right? But at the same time, does not mean you have to accept abuse. You have to accept disrespect.
Yeah.
And so how do you walk that fine line? And I think at the end, I started not walking the tight line, and I started just
doing it.
But when you're at the beginning stage of any career, of any training, you have to be very careful about what you can and cannot do. And it's very hard, when you're being called a terrorist, when you're, it's very hard. Like, I tried very hard to resist being Somali when I was, in my early training, but afterwards, the Somali came out.
MashaAllah. Thank you for coming down here. I think that's going to be our episode for today. You obviously came a long way. We have the Somali Health Board event tonight in Seattle, and we appreciate you coming down to talk to us. How can people get in touch with you? We're going to leave some of your social media links on this post. So how do you prefer they sort of get in touch with you, and what kind of stuff do you usually advise on?
So you can get in touch with me. I'm more active on Twitter. It's at Qaali Hussein 1. I'm also on Facebook, Qaali Hussein. I'm on Instagram, I think, Dr. Qaali Hussein.
Yeah.
So you can, I get a lot of questions about pursuing medicine, motherhood and medicine. I would love to get a lot of questions regarding how, what specific steps to take to be part of the change.
Okay.
Right? I think, a lot of these fields seem to be closed off to us because, it's very hard to be the change. But as someone has said before, I can't remember who it is, be the change that you want to see in the world, right? So, and if we're not actively taking that step, then I think the disparities and inequalities will persist.
Perfect. And that's it for today. I want to thank you guys all for listening. If you're listening to this on Apple Podcasts or any other podcasts, please leave a comment. Tell us what you think about the show. Tell us how we could improve. You can also please leave a 5-star review if you're listening on YouTube and across our other social media accounts. Leave a comment, share, and you can message us about this podcast and what you think about it and how we could also make it better for you. And we'll see you next week. Thank you.